Today we're going to talk about a very serious condition where patients often complain severe pain in the upper stomach. This pain lasts for several hours. Patients often complain nausea, vomiting, heartburn, gas, loss of appetite, and all these symptoms go on for several months, several years, until there is a day where the patient experiences unbearable pain, and when a sonography is done, it is confirmed that the patient has CHOLELITHIASIS, which is gallstones. It's very important to understand gallstones and kidney stones. These are two different conditions. Gallstone is a serious problem. It needs proper medication, strict diet, continuous medications. It is not a condition where the stones may dissolve in a day or two, a week or two, or a month or two. When it is increased, patients have a terrible time. The pain is very much severe. There are a lot of symptoms as the gallstone increases. Patients may think that endoscopy is the way to go, wherein the gallstones that are there in the bile, it would be removed. But very important, these gallstones tend to reoccur as well. Whereas on the other side, there is cholecystectomy, which is removal of the gallbladder itself, which may not be the choice of treatment for every patient. Hence, patients come to Ayurveda for a natural cure, for a permanent cure, and that's exactly what we're going to discuss in this particular video. We're talking about gallstone and its permanent cure in Ayurveda. Make sure you watch till the end. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. In the previous time, it was found that gallstones were commonly seen in FFF, fat, fertile and female who are around the age of 40. In today's time, we see it in the age of 20s as well. Gallstone complications are commonly seen in the female population, which is 61%, as compared to the male population, which is 39%. Let's understand which people are more prone or more likely to develop gallstones. Number one, obesity is a big factor because it accelerates the cholesterol level, wherein it makes it very much tough for the gallbladder to remain empty. The second reason, women who take birth control pills, contraceptive pills, extra estrogen levels, it increases the cholesterol, high risk of gallstone. The third reason, simple one, it is diabetic patients, immunocompromised, and these diabetic patients, they often have high triglyceride levels, results in gallstone. And fourth are of course those patients who tend to take regular medications to reduce their cholesterol levels. A big reason why does gallstones occur, it is of course excessive amount of cholesterol in the bile. We see nausea, vomiting, severe pain, patient is not feeling hungry, there is terrible pain in the abdomen. This goes on for several hours in spite of taking various medications and IV fluids. We see the pain is very difficult to manage in most cases. The stone tends to just increase with the following months, following years. Initially, if it is diagnosed, it is very easily curable with simple do's and don'ts as well. But we see when the pain becomes unbearable, that's when ultrasonography is done, and that's where the right treatment is something that patient approaches. Now, most of the time, even patients are often told that there is no medicine, either cholecystectomy, which is removal of the gallbladder itself, or simple do's and don'ts are often explained. Let me tell you, whether it is a small stone or whether it is a 10 mm, 12 mm, 14 mm stone, Ayurveda has the ability to dissolve it. Of course, gallstone, kidney stone, these are two different conditions. It may not dissolve in a day or two, a week or two, or a month or two. It needs serious treatment, proper medications and proper panchakarma, proper diet for it to dissolve naturally and permanently. Cholecystectomy, gallbladder removal may not be the choice of option for every single person, because we often see post cholecystectomy there are various symptoms that patients have. There is unbearable acidity, joint pains, we see weight gain. There are various symptoms, various complaints that patients often tell us when they have done their cholecystectomy. Hence, patients do prefer an Ayurvedic cure. Of course, Ayurveda provides the right treatment, complete natural treatment, But approaching the Ayurvedic doctor at the right time is very, very important. Of course, time of recovery depends on the size of the stones, which depends on how early you approach an Ayurvedic doctor. Ayurveda has a wide spectrum of medications. There is combinations, formulations, home remedies, do's, don'ts, panchakarma, therapies, treatments. There are n number of treatment protocols in Ayurveda for the gallstones to be completely cured in a natural way. There are hepatoprotective medications like the Kutki, Bhumi Amlaki, Arogyavardhini. There are the medications that dissolves the gallstones. There are medications to relieve the acidity, to increase the hunger. There are Dipaniya, Pachaniya Dravyas, Bhedaniya Dravyas. One of the best Bhedaniya Dravya is Kutki. Kutki is the most useful medicine when it comes to gallstone, as it is well known for its Bhedaniya Karya. There are wide range of medications, even simple remedy like applying castor oil over the gallbladder. Gallbladder is located below the liver. So just applying it over the gallbladder area relieves the patient. Even a paste of Yashti Madhu and Punarnava, mix it in equal amount, these two powders, and apply a paste with water. This even gives relief to the patient. The right treatment is the Ayurvedic medicated purgation, which is called as Virechan. Virechan is the most authentic and the oldest method of detoxification, which is also a prime treatment when it comes to gallstones. So proper, mrudu Virechan, proper Virechak dravyas, whether it is the castor oil, whether it is Abhayadi Modak, Trivrut Avaleya, Icha Bedi Ras, there are various kinds of Virechak dravyas that gets all the doshas from the shaka into the koshta, and the doshas that are there in the koshta, it is eliminated out of the body. Even if the koshtagat doshas are eliminated, the patients start getting relief. Hence all these Virechak dravyas, the hepatoprotective medications, the Dipaniya, Pachaniya, Bhedaniya dravyas, these are very, very useful when it comes to gallstones. Of course, Ayurveda has a wide range of treatments. It is very important to approach at a very early time for faster recovery. Also, there are various misconceptions when it comes to gallstones, but the most important part with regards to the myths when it comes to diet, it is 3 kinds of foods which are always advised to be avoided. Number 1, every kind of dairy food, whether it's milk, paneer, butter, cheese, khoya, milkshake, curd, buttermilk, all these items one must avoid. The second one is all the kinds of bakery items. And third, very simple, very easy, reduce or completely avoid the intake of non-vegetarian foods. There is fish, red meat, chicken, mutton, all these items should be avoided. These are the 3 simple rules: dairy, bakery, and then there is the non-vegetarian items. We spoke about application castor oil, Yashti Madhu, Punarnava, Lep. We spoke about Kutki. All these combinations or home remedies, it is always advised to be taken or followed under an authentic Ayurvedic practitioner's guidance, because gallstone is a serious problem and it needs serious treatment. Just remedies, just the do's and don'ts may not be enough. Very important to not wait till the stone increases in its size. Very important to take the right action at the right time to cure the root cause for it to dissolve completely. This was all for now. If you have any doubts, any questions, let us know in the comment section below. Until next time, from Jyovis and the team, look impressive, be progressive.